Okay, so if you're a woman and you've been told that your thyroid levels look normal, like so many women have, or you've been taking thyroid medication, but you still don't feel good, you're still tired, you can't lose weight, your hair is thinning, the anxiety or brain fog isn't letting up, you're doing everything your doctor has told you to do with no improvement. Also, deep down in your gut, you know that something isn't right. You know that you can feel better. If that's you, stay tuned, because in today's video, I want to share with you something that I think is incredibly important for women, regardless of your age. And it's something that many traditional doctors and even functional medicine doctors often miss. Hey, I'm Dr. Hagmeyer, and for just a moment, I want you to consider this. What if the missing piece to your thyroid problems isn't your thyroid at all? What if it's your progesterone levels that's quietly sabotaging your thyroid function? Well, today I'm going to share with you how low progesterone affects your thyroid hormones, some of the symptoms that it can cause, and really 4 key areas of your body that really can have a massive impact on bringing progesterone levels back into balance without having to jump into hormone replacement therapy, because not every woman wants to do that. Progesterone's impact on thyroid hormones is more than just about fertility or having a regular cycle. It's also a key player in how well other hormones work in your body, especially thyroid. And let me explain this. Think of your thyroid hormone like T4. That's the raw material that your body uses to convert into T3. And T3 powers the energy within your cells. Progesterone also helps with that conversion. So without enough progesterone, you're not converting or making enough T3. And when progesterone is low, estrogen becomes dominant. And that also becomes a problem in its own. And here's why. Too much estrogen ramps up something called thyroid binding globulin. And that acts like a sponge. And so it soaks up your thyroid hormones so it can't get into the cells. And that is why so many women, despite taking thyroid hormone replacement, can have normal looking thyroid hormone levels on paper, but inside your cells are starving for T3. They're deprived of T3, running on empty. The answer is not T3 replacement. The answer is reducing the elevated thyroid binding globulin, improving T4 to T3 conversion, and correcting the body's physiology that's causing low progesterone or this estrogen dominance. Again, taking T3 doesn't fix the root cause. It's still just a Band-Aid. All right, so let's talk about symptoms. When progesterone is low or you have elevated thyroid binding globulin and your thyroid can't do its job properly, you might notice that your cycle becomes irregular or becomes very heavy. PMS symptoms like mood swings and irritability and anxiety. Maybe trouble falling asleep or staying asleep. In some women, you feel cold all the time. Weight gain that seems impossible to lose. Hair that's thinning. The outer edges of your eyebrows also thin. Brain fog. Low motivation. Constant fatigue. And again, when we start connecting these dots and we look at the bigger picture, we often see progesterone as one of the missing links between thyroid function and how you actually feel. Now let's talk a little bit about why these progesterone levels drop and why aging plays a part, but there are other key players as a piece of this puzzle that need to be considered. All right, so one of the questions we really need to ask ourselves is, why is it that progesterone levels are bottoming out in so many women? So let me give you 4 reasons that your progesterone levels bottom out beyond aging. All right, number 1 is stress. You've been dealing with stress for an extended period of time. When your body is under this chronic, prolonged stress, even if it's perceived, your adrenal gland diverts its resources to make more cortisol. That's a stress hormone, and it does it instead of producing progesterone. This is why it's critically important to also test cortisol levels and DHE levels when you have thyroid problems. There's a massive connection between your adrenal glands, cortisol, and thyroid hormone levels. And most women over the age of 50 are going to have some degree of adrenal gland fatigue or what we call HPA axis dysregulation. Another culprit for low progesterone and why your thyroid is sluggish is your blood sugar, or I should say blood sugar swings. 1 in 3 people have insulin resistance and don't even know it. So again, high and low blood sugar destabilize your hormone balance and they leave progesterone levels being low. Again, causing the fatigue, the depression, the anxiety, the sleeping problems. Again, your thyroid's not going to work properly if you're insulin resistant. Diabetes and thyroid problems are like head and tails on a coin. You may not be a full-blown diabetic, but problems with your blood sugar will affect thyroid hormones and consequently progesterone levels. You can't ignore these. All right, next we need to talk about inflammation. I often see this in patients when we run blood work. Maybe they've got elevated ferritin levels or elevated CRP levels or elevated ESR levels. Again, these are some blood markers that indicate you have inflammation. Now, if you're a cycling woman, chronic inflammation inhibits luteal phase progesterone. That means you're not going to produce progesterone in the second phase of your cycle when you should be. Now, if you're menopause, chronic inflammation can cause problems here too. It can cause problems with metabolic clearance. In other words, chronic inflammation is going to accelerate the breakdown of progesterone. So really, the moral of the story here is that chronic inflammation is no friend to progesterone levels, regardless of your age. All right, the next thing I want to talk about that I think about is gut dysbiosis. Now, if your gut isn't functioning optimally, or you have problems in your methylation pathways, you can't metabolize hormones the way you should, your estrobolome is the connection between your hormones and your gut health. Now, the estrobolome helps in the breakdown and the regulation of estrogen levels in our bodies. It converts estrogen into various metabolites, some of which can have different biological effects. If you have gut dysbiosis or an overgrowth of gut bacteria, this can really influence your estrogen to progesterone ratio or that balance. The end result of these gut issues is that your progesterone levels drop, your thyroid hormones are not produced or used correctly by your body, you develop estrogen dominance, and your symptoms never improve and almost always get worse. So I want you to see the big picture here. It's not just about replacing or dumping progesterone or T3 into the body. In most cases, to address the root cause, you're going to need to look at the big picture and fix the physiology. Now, let me give you some things to work on. If you feel you need more support, then I would suggest you reach out to my office, you visit my website. There's a lot of information there. All right, so how do we support progesterone naturally? So there are certain steps that you can take to naturally support progesterone production, and I want to kind of go over that with you. And here's the encouraging information. You don't always need or have to jump right into hormone replacement, right? There are simple and natural steps that support your body's ability to make and even balance progesterone. And so let me give you a few of those. Let's review some of those here right now. Number one is managing stress and cortisol levels. I mentioned that just a moment ago. Chronic stress robs your body of progesterone. Support your adrenal glands with pregnenolone or DHEA if your levels indicate it. Incorporate daily stress reduction, whether it's deep breathing, prayer. Adrenal adaptogens are very helpful. Ashwagandha, rhodiola, vitamin C, phosphatidylserine. Again, these things help stabilize your adrenal glands. Number two is stabilize your blood sugar. How do you do that? Well, eating balanced meals with protein, healthy fats, and fiber. This keeps your blood sugar stabilized and steady, which again protects your hormones. If you have problems with blood sugar, don't eat excessive carbohydrates. Don't drink your calories. Supplements that I often think about are things like zinc, chromium, alpha-lipoic acid, vanadium. These are things that, again, will help you stabilize your blood sugar. And again, stabilizing blood sugar will help your hormones. All right, so the next thing is nourishing your body with key nutrients. Here you want to think about magnesium, vitamin B6, omega-3 fatty acids, zinc, vitamin C, again, all essential for progesterone production. Next thing is improve gut and liver. Remember, your gut and liver are in charge of metabolizing hormones. Focus on correcting digestion with things like digestive enzymes and bitters. Correct problems in your gut microbiome. Here's where things like probiotics, prebiotics, postbiotics, things like L-glutamine, colostrum, beta-glucans, collagen, turmeric, again, digestive enzymes, all things that can go a long way in helping process imbalances in estrogen. And by doing that, it frees up that progesterone, which in turn helps your thyroid. Here's the bottom line and really what I want you to take away from today's video. If you're struggling with thyroid symptoms and your labs won't normalize or stabilize, don't overlook progesterone levels, right? Hormone balance is a critical part of thyroid health for all the reasons that I mentioned in today's video. If you need help or you like help figuring out whether low progesterone is a part of your thyroid story, visit my website to learn more about my practice. And if you liked today's video and you found it helpful, here's another video that I'll either post over here in this corner or in this corner here that I think you're going to like.